My name's Kiran. My background is general nursing and I work for Birmingham, Solihull ICB, and I'm one of the Continuing Healthcare Nurse Assessors. My background, so I'm adult nursing. Initially I started in cardiology, then I moved to sexual health, and then I've worked within 3 different ICBs. So as a CHC nurse, the main role is completing continuing healthcare assessments. So that's working with local authority social workers and other MDT members who are involved in that patient's care. And basically CHC is to see if someone's eligible for NHS funding towards their care package. Also, you've got the financial component. So for CHC eligible patients, you'll be attending panels just to make sure that we are meeting their needs and we're cost effective as well. So a patient that I've recently seen is a CHC eligible patient who lives at home by herself, and we currently provide care in the property during the day. And she wasn't due her 12-month CHC review, but there was concerns raised by the neighbour and the care agency. So the main concern was that this lady was very anxious during the night, so she would go out onto the street. She lived on a fairly busy road and she'd be knocking on a neighbour's door. So we did a urgent continuing healthcare review at the property with the care agency, and we provisionally put in night care, and then we reassessed the care package, and we assessed that with the night carer, her anxieties were being alleviated and we were reducing a number of risks. Within Birmingham Solihull ICB, there's 3 different localities that covers the area. So within each locality, we have a band 8A, we have band 7s and band 6s. So you're really well supported, which is really important. And we have weekly catch-ups where we can share complex case management. If we're struggling with certain scenarios, we can discuss it with our peers and seniors, just to how to handle the situation. Work and family life balance, working through the hybrid model is really good, especially as a mum of 2 small children. I find it really helpful. So I personally work 8:30 to 4:30 Monday to Friday, and that allows me to take the kids to their after school clubs. We don't work bank holidays or weekends. There's a few things that I like about my role. One of them is I'm able to showcase values that are particularly important to me. So that's showing compassion and empathy, because you're going in to see a patient and an next of kin, it affects them too, where there's a significant change in their health presentation and their day-to-day life has suddenly changed. So, and it's a really sensitive time for that individual and their loved ones. So I think having good communication skills and exercising those values, I think that's really good.